Hello everyone, I will discuss on OECD guideline 430, the in vitro skin corrosion test using transcutaneous electrical resistance apparatus. So it was adopted in 1981, revised in 1992 and 2002 and 2015. So the main purpose of this guideline to identify the corrosive and non-corrosive substance on skin. So the skin corrosion refer to the irreversible damage of the skin, including visible necrosis through the epidermis to dermis. So the main methodology that we use the rat of the skin of the rat and transcutaneous electrical resistance apparatus. So transcutaneous electrical resistance apparatus is a in vitro method that used to identify the corrosive substance that affect the skin integrity and barrier function. So the main principle of this guideline, it is based on the transcutaneous electrical resistance method, which utilizes the skin disk to identify the corrosive substance. So corrosive substance has the ability to lose the stratum corneum layer and skin integrity, and there is certain limitation in this method, that it does not allow to subcategorization of the corrosive substance, and it has a wide range of suitability for the chemicals except gas, aerosol and other mixers. So this is all about the introduction. So the procedure that we use, the test chemicals applied over the epidermal skin for 24 more, up to the 24 hours, and the procedure, we will take 22 days old rat and remove the hair on dorsal fang side of clip area, and clip area wash out with the antibiotic solution streptomycin, amphotericin B, etc. To inhibit the bacterial growth, and after 3 or 4 days we again wash with the antibiotic solution to recover the streptocorneum layer for the skin integrity. So on 28 to 30 date, killed the rat and placed on the skin disc in a transcutaneous electrical resistance apparatus in the receptor chamber. Receptor chamber contain the MgSO4 magnesium sulfate on 154 microliter volume to act as an ion connected with the electrode for the conducting the electrical conduction, and measure the electrical impedance of the resistance of the skin. So this is the TER. We place the skin disc on the polytetrafluoroethylene tube, and on the other side there is a side O-ring rubber tube, which is used to press for the securing the place of the skin disc using petroleum jelly, and the receptor chamber contain MgSO4 solution around there within the on the transcutaneous electrical resistance. In this method we also use a dye binding agent for the confirmation of the positive result, but in this method we use two animals, the test animals and the control animals. The control animals, in the control animals there is positive animals. The positive control animals using 10 ml hydrochloric acid as a chemical, and in the negative control animal we use a distilled water. So this is all about the transcutaneous electrical resistance method procedure, and the interpretation of the result using transcutaneous electrical resistance. It identify the corrosive and non-corrosive substance. There is a certain cutoff value 5 kilo ohm. So non-corrosive substance material can reduce the electrical resistance of the skin below the 5 kilo ohm cutoff. So by using this method we can measure the electrical impedance of the resistance of the skin, and differentiate the corrosiveness and non-corrosiveness of the chemicals by using these guidelines. We also use in this method in the dye binding agent to assess the penetration of the chemical within the skin. So we apply the sulforhodamide dye to the skin surface, and stain of this dye underlying the tissue indicate the skin corrosion, examine the major damage for the skin as a perforation. So dye binding agent used to confirm the positive result of the test and determine the ionic permeability of the skin destruction of the stratum corneum layer. So we use a TER, transcutaneous electrical resistance method, to measure the electrical impedance of the skin to the resistance of the corrosive substance and non-corrosive substance with the certain cutoff value 5 kilo ohm. And we use a dye binding agent through the underlying staining within the skin. We can confirm the positive result of this guideline. So this is all about the summary of this guideline OECD 430, the in vitro skin corrosion test. Thank you.